Good morning, everyone. Thank you so much for joining us today on a beautiful day outside in Minnesota. Our session today is a combination of experts and those who've had experience in really sharing our knowledge that it can help you in your work and in your career development. It's a panel format discussion, which is why we're doing it virtual, and it will be recorded and shared out with those who could not attend today. My name is Rahel Gebra. I'm a gynecologic oncologist and faculty here at the University of Minnesota. I'm also the associate director for our program to enhance workforce diversity. Today, we have a panel discussion on expanding health disparities research, which is critical to serving our community, and also expanding diversity in our cancer research workforce. I'm joined today by Amanda Dion, who is here on behalf of our Center for American Indian, Native Health, and she'll talk a little bit more about their work in our collaboration with our Cancer Center. Dr. Heidi Eichbiker is here, who works with me in our program to enhance research and workforce diversity. Dr. Lisa Peterson is here as well. And then we have two representatives from the NCI, Dr. Anil Wali and Jay Rivilleza, who will be present slightly later as we go along with the program. Next. This is just showing you our panel who are currently present and will be sharing their experience and knowledge with you. In particular, we are really thankful to Dr. Wali and Dr. Rivilleza for being present here from the National Cancer Institute on the Center to Reduce Cancer Health Disparities, which is part of the Integrated Network branch. Okay. This is just a brief overview of what we're going to be sharing with you today. And the format will be, I'll start us off into the sessions, and then we'll just pass it on from one person to another. So for the speakers, if you sense that your slides are up, please go ahead and introduce yourself and take over so that we have a smooth transition. We do want participation from our audience, and so please use the raise the hand, but go ahead and ask your questions along the way so that we're sure to answer them and we don't overlook and have a interesting conversation and discussions, making sure that we answer your questions. The agenda will cover our work around training navigation and the aims of the program. We'll have our team present here who will describe some of the work that we're doing with the Center of American Indian and Minority Health, who are really a very integral and most important members of who are undertaking this work. And of course, the NCI, and then we'll have Dr. Eichenbarker, who will talk a little bit about the opportunities that we'd like to share with you and ways to reach out to us again. Next. Amanda, it's yours.
Good morning, everyone. My name is Amanda Dion. I am the Assistant Director for the Center of American Indian and Minority Health. I am a citizen of the Northern Cheyenne Tribe and also from Turtle Mountain. And I am here this morning to share more about who the center is and our collaboration with the Masonic Cancer Center and the work that we are doing around navigation support for American Indian Alaska Natives to enter into cancer careers, as well as seek opportunities for grants and funding from the National Cancer Institute. So a little bit more about the center is that we have been in existence for more than 50 years and have recruited, supported, and graduated Native American physicians who serve Native communities locally, regionally, and nationally. Our strength is the relationships we build and maintain with Native people and their communities in Minnesota and beyond. A large part of our work under our current leadership, Dr. Mary Owen, is around workforce development. We have huge inequities within American Indian communities around health outcomes, especially when it comes to cancer. Cancer is the second leading cause of death for American Indian and Alaska Natives. And so there is a huge need for American Indians to be within the spaces of cancer, whether that's around research, public health, as physicians, et cetera. And so when we were approached about this collaboration from the Masonic Cancer Center, we thought that it fit perfectly in alignment with the work that we're doing now. One of our national efforts that was started by our center director, Dr. Mary Owen, is called iHeart, and that is working with healthcare providers across the nation around developing workforce development strategies on both a national scale, but as well as a regional and local scale. We have huge vacancy rates within our IHS clinics. And so one of the strategies and solutions that we are working on is increasing graduation rates within Minnesota, as well as in our tribal communities, and really wanting to recruit future healthcare professionals from those communities so that they can go back and serve those communities. So next slide, please. Now we'll share some accomplishments that resulted from this collaboration so far. We were able to bring on a wonderful team member named Donis Chosa. Donis is Ojibwe from the Kinawa Band or Kinawa Bay of Indian community, which is located in Michigan, and she's also from Boyce Fort. She was born and raised in her tribal communities and then came to Minneapolis as an adult, where she started a position at the American Indian Cancer Foundation. And with her experience around public health, cancer prevention, as well as she just completed a master's in leadership, we thought she would be the perfect team member to bring on board to help lead this effort with the Masonic Cancer Center and the Center of American Indian and Minority Health. And then she's also deeply rooted within community. She's a well-known and respected community member within the urban Native community here in Minneapolis, as well as across the tribal communities in Minnesota. At the Cancer Foundation, she led policy, systems, and environmental work with our SHIP program. And so she did a lot of work around cancer prevention, specifically with all tribal communities in Minnesota. So she has lots of networks and lots of connections. And again, we are very grateful that she joined our team. So part of the work that she led at the American Indian Cancer Foundation and research that they did was developing culturally tailored resources. And so when she entered into the role here at the center, as well as Masonic, she wanted to focus on developing cancer navigation resources that were culturally tailored. And so as you can see in the bottom left-hand corner, there is a resource that was guided by her work, and it depicts American Indian Alaska Natives. Representation is huge in our community in order for us to feel like we're included, as well as being able to be served in a good way. Representation not only on print materials, but within clinics, within institutions is huge for our communities. And so that is a representation of that. In addition to developing the culturally tailored resources, she has been able to work closely with Dr. Eichenbacher to work with American and Alaska Natives that are early in their career, including students, staff, and faculty that are interested in cancer careers, and to learn about the available options within the Masonic Cancer Center, as well as the National Cancer Institute. We at the center have recently opened a Twin Cities campus location where we have center staff, faculty, as well as students, American Indian Alaska Native students across all health professions here in the Mayo building. And so on April 23rd, we held our grand opening, and Donis was an integral part of creating a space that is culturally responsive to our American Indian Alaska Native students, as well as faculty. In addition to those accomplishments, as a result from this collaboration, the center, as well as the Masonic Cancer Center, have collaborated on grant proposals. We have been able to increase our presence at American Indian Alaska Native events. And so those include youth events like the Science Museum, American Indian Youth with Stethoscopes. We've been to quite a few powwows, and we're really trying to spark that interest with our K through 12 American Indian Alaska Native students so that they get excited about exploring careers in healthcare as well as cancer, knowing that many of them have been affected personally by cancer. And so being able to start engaging with that demographic so early on, we're really hoping that it will support the pathway of that population into some of the programs at the Masonic Cancer Center, as well as the Center of American Indian Minority Health, so that they become interested in becoming future healthcare providers. This spring, we held a gaps analysis of needs for American Indian Alaska Native students in healthcare programs. For this first one, we held a gaps analysis group with our medical students, our American Indian Alaska Native medical students, and so they were able to provide a wealth of information about what resources and supports that they would like to see in order to help the next generation of medical students come in and be successful throughout their programs. And we were able to actually include one of their recommendations into a current proposal that we have recently written. And so that was a really phenomenal engagement opportunity to learn from them. And another recommendation that came out of that is starting early stage pathways are critical for their success in order to be able to achieve the career in which that they want to. So some of the residency programs that they're interested are extremely competitive. And so they were sharing that if support is offered earlier, that it would help them with that. And so, yeah, thank you. I will pass it off to Dr. Ashabasher.
Thanks, Amanda. Sorry, I didn't mean to switch the slides quite so early. So, in addition to the accomplishments that Amanda had mentioned, we've done also just a survey of some of the students, staff, and faculty who are on cancer grants at the University of Minnesota to see who is underrepresented in science and medicine according to the NIH definition. And that's where a lot of the grant opportunities are in this training navigation space, and also who's interested in cancer disparities research, which is yet another way to become involved. And we'll talk a little bit more about that later. But here you can see the notice for the NIH definition of underrepresented in science. A key thing to remember there is just that there are a lot of people who are underrepresented who may or may not know it. And so it's really helpful to go to that definition because especially in the disadvantaged background category, when people receive federal assistance in their upbringing, or if they are first generation college student, or also come from underserved areas, especially in rural areas, those are ways that people can be considered underrepresented in addition to race, ethnicity, and disability. We are also providing a little bit more support for writing for bio sketches, and we're trying to increase that along the way as we also learn more as well. And so the NCI program officers want to have bio sketches, and sometimes for early career people, especially students or undergrad or graduate students who haven't had exposure to those, we're trying to provide support for them, but for anyone, honestly, who wants to have a little bio sketch support. And then there's open office hours, and you'll be able to see a QR code and a link for those open office hours on this page. So what we're doing is we're helping you identify NCI grants through training navigation that fit your interests and backgrounds. So we want to get to know you. That's a key part of this. The grants and training also from private and government sources other than NCI are something that we have been tracking a little bit more, and especially anything that focuses on career development. We also have a list of U of M career advancement opportunities that are from the NCI and in other places. And just along the way, as we get to know you, we can things come by our emails and through our listservs that we can inform you of new opportunities that might be of interest. So to give you an example of what we're talking about, here's some of the opportunities that we have at the University of Minnesota that are not NCI. So we have a Preparing Future Faculty series that's for graduate students and early career faculty. We have a equity certificate hosted online, or ECHO, which is out of the Office of Equity and Diversity, that helps to for staff, students, and faculty to learn about how to put DEI in action in your work and everyday lives. There's Just Ask, which is a ACCC program that's free to the University of Minnesota for clinical people who work with clinical trials or other clinical research, to learn how to just ask people about their identities and their needs when it comes to clinical research. And that, again, is free for everyone at the University of Minnesota when you have a login through the ACCC. The Robert Wynn Diversity in Clinical Trial Award is yet another thing that we're trying to get more applicants for. This is for people who have a medical degree or are in medical school. The medical degree program is for 2 years with peer mentoring and training to prepare people for clinical trials. And then they have a summer institute for medical students. Lastly, the National Center for Faculty Development and Diversity is a career development program that's general through the University of Minnesota for people who, as they sometimes say, are the only one in the room or one of the few in the room, people who aren't highly represented, to have career development opportunities and also and have some community around career development. So those are some examples, but there's more things as well. So here we'd like to, now we're going to get into the NCI work. The NCI grants, and I noticed that Dr. Wally and Dr. Rivilleza are here in the audience, and we can have them chime in as well by using the raise hand feature, or else we can have them log in through our webinar series via the email that they received. But what we want you to do is connect with them today and connect with us about NCI grants and supplements. And these are the ones that are available for you for cancer disparities researchers. For cancer disparities researchers do not have to be underrepresented in science and medicine. You can be of any background, but the key here is that you have to be doing some sort of cancer disparities research. And there are collaborative grants that are available to include cancer disparities research on an existing NCI grant that does not currently have a disparities focus. Right now, there are 43 grants for the University of Minnesota that would qualify for the September 6th deadline for this route. And so if you are a cancer disparities researcher, you are interested in working with others at the Cancer Center to include cancer disparities research into their grants, please reach out and we can share that list with you. We also have there's also a basic research in cancer health disparities grant that is for our 21 R03s that are due in June 2024. These are for people who are underrepresented or also who are not underrepresented, but who are early career and new investigators or existing investigators. So that is yet another piece that Drs. Wally and Rivilleza, sorry, I hope I'm pronouncing that right, can speak to. And lastly, there's a comprehensive partnership to advance cancer health equity grant, the U54, that'll be due in October 2025. And there again, we can connect you to the program officers and discuss that more, and also work together on potential applications. Now, this is where the bulk of the career development opportunities are, and this is for people who are underrepresented in science and medicine. And one of the key ones we have is a diversity supplement, and that's to work on an NCI or another NIH grant NCI is the one that we're focusing on for training navigation, but diversity supplements are NIH wide, or almost all NIH, I should say. Currently, we have 72 grants at the Masonic Cancer Center that would be eligible for the October 1st deadline. So if you are underrepresented and you wanted to look at a grant, we have 72 options for you. So there again, we can share those with you. We recently had someone who I noticed is on the call who submitted a diversity supplement and got it successfully. So, and then we also will be talking with Lisa Peterson on the next slide about her experience as a PI on a diversity supplement. There's reentry and reintegration supplements. That's for people who had a shift time away from research and are coming back into the workforce, or a shift in employment. And there again, there's lots of options for that to receive additional training or reentries so that people can advance their cancer careers. There's a pre-doc fellowship, which is an F31. This one does include international applicants in addition to people who are underrepresented. Generally, most of these are for US citizens, permanent residents, or non-citizen nationals, but this F31 does include international applicants. There's the intramural continuing umbrella for research experience, or ICURE. This is to work, this is not really through the University of Minnesota. I mean, you can connect to us through the University of Minnesota, but what happens with this one is you would go and work at NCI for 2 to 3 years, depending on your career stage. If you're a graduate student, it's 2 years. If you're a postdoc, it's 3 years, but it's a chance to get experience of working at NCI in cancer research. Then there's the Research Career Development Awards, and a lot of people who are already familiar with K, but this is the K01. There's tracks for K01, K08, and K22, both clinical trials or non-clinical trials. And exploratory research, the R21 in basic cancer research, is an emphasis for the NCI career development programs. And lastly, the early investigator advancement program and the cancer moonshot programs are the early investigator advancement program is a cohort to prepare an R01 for people who have not had an R01 or equivalent. And you get support from a cohort of people and NCI program officers over the course of several months, and to hone your R01 grant writing skills and to actually prepare one. Cancer Moonshot is for innovative R01s, especially for people who are underrepresented. So now we're going to talk a little bit more about the diversity supplements, since this is probably one of the most common types. And so, like I said, we have 72 grants that could be eligible for the October 1st deadline, which when it opens up again for NCI. And Dr. Lisa Peterson is here and has had some experience in submitting a diversity supplement. Dr. Peterson, would you like to comment on your experience?
Yes, I'm happy to do that. So I had a student who was African-American join my group in 2010. So my experience is a bit old, and I imagine some of the processes changed. After communication with the program officer, we submitted an application and it was funded. And I will say that it was a great opportunity for the student. It was good for me too, because it provided an additional person to work on the project through those funds, and it did free up money for the student to hire underrepresented undergraduate student to help her advance her science. So I would highly recommend it. Back then, and I guess the people from the NIH can speak to this, what the current experience is now. We did find out months ahead of when the money showed up that it was going to be funded, but they waited until the start of my next funding year to release the funds. So there's some timing issues, but it was a relatively straightforward process. It expanded my ability to do research. It trained a good student who continues to contribute. She is in the infectious disease industry now. She was trained in my lab as a toxicologist. She's currently working at a infectious disease company that is developing vaccines for a variety of different diseases. But I think, and then the undergraduate that worked for her that we were able to bring in because of the money that freed up has gone on to a career in cancer. So it served as a multiple training tool. Did I hit all the points you wanted me to hit?
Yes, I think so. Thank you. And one other thing, the person who just recently received a diversity supplement wasn't able, actually at a conference right now, so she was not able to come. But one other thing that she said that recently in their experience, one of the key things that was very helpful as a new investigator was to learn what it's like to submit a grant through a university and to know about all the different steps that one has to do. And the other piece that she said was also quite helpful is one of the things that the NCI program officers asked them to do for her diversity supplement was to explain how she would contribute to the research in a new way that wasn't in the original grant. So what the added value was for their participation in the supplement. So that was the one other piece of information on that. I apologize, I noticed someone told me that the QR code is not working, but that Z link should work. So I apologize that the QR code is not going to work for you probably, but I can put the code in the chat. So now we have Drs. Wally and Rivilleza on the line. If you would like to chime in, feel free to use the raise hand feature and you can come into our discussion.
Well, can you guys hear me?
Yes, thank you.
Oh, wonderful, wonderful. So first and foremost, we have to thank you for organizing this session. This is phenomenal, and this is really trend-setting for the rest of the network. And I don't know how many members we have in the audience, virtual audience, but we are expecting at least all the students as well as some of the faculty members that you mentioned, that you guys have 72 potential mentors with R01 funded investigators at Cancer Center. So this would be a great opportunity for all of them, trainees as well as the faculty members, to ask us any questions. Dr. Wells and I are more than happy, and we would love to entertain any questions about the funding mechanism that you so eloquently described. And we have also provided the large slide deck as well as the presentation as to how to put together those training grant and research grant applications together. So we were very excited to see that slide where you have put all the compendium of all the NOFOs in one slide, and that was very phenomenal. So I think it's a great service, and we may want to replicate this same format for other 9 cancer centers throughout USA. So we are here to help address any question, concerns about any of those funding opportunity announcements that you mentioned. And besides the eligibility criteria, yes, this is the best slide. We loved it. So this basically gives the essence of all the funding opportunities, and the notice is available to all the Native American applicants, and we have a dearth of that in our portfolio, because majority of our portfolio is African American, Hispanic, Latinos, but very little Native American, Alaska Native population. So we are really interested in finding out and reaching out to those potential trainees who could be helped, and we could do the matchmaking with the R01 funded investigators. So there are plenty of opportunities, 72, as you rightly mentioned. So it's this matter of making the perfect matchmaking, and the initial step has been already conducted, that providing us the bio sketches, which was the first step. So that the next step is making that mentor-mentee connections, so that for submission deadlines, F31 fellowships or diversity supplements or KO1s or KO8, K22 portfolio would be available to them. And I think we have some recordings of our, we have shared about F31, how to put together F31, that you have already disseminated among your trainees and faculty members. But we have also recording of how to put together career development awards. So Dr. Laritza and Shahruz, they have put together that webinar, and we would be more than happy to share that recording. And that would be a prerequisite for any mentor-mentee team who intend to submit a grant application to watch that webinar, and it clarifies and provides details as to how a successful grant application could be put together. So I will stop here and let my colleague, Dr. Rivilleza, join and say a few words.
I hope you can hear me. Can you hear me?
Yes, yes.
Okay, thank you so much. Thank you so much, Anil. Thank you so much, Heidi, for inviting us. And I'm really impressed with the report from Amanda and Danis and Lisa. We are so thrilled to be part of this discussion today, and hopefully with a very brief time that we are participating, we are hoping that this is a start of a longer conversation where we can share best practices and nuggets on how our potential trainees from the University of Minnesota and the neighboring MSIs can participate in NCI programs. As you know, CRCHT has a very strong push now to really involve Native Americans and Alaska Natives to really enjoy and participate in the programs that can facilitate workforce development, improving infrastructure, research impact, and really engagement and collaboration. I really like what Anil said. I'm really impressed with the summary of how you connected all the career development opportunities in one slide. I really love it. And you know, there are institutional as well as individual opportunities that can be explored. And of course, it will be great to really leverage the resources from the cancer centers, the MSIs, and of course, NCI knowledge base to really improve application to each of these opportunities. First and foremost, you need the candidates must be able to identify what opportunities they're interested in, and what are the deadlines for such, and how to be competitive. Now, being competitive can be gauged primarily on the buy sketch. And I'm very happy to note that Heidi's group has really pivoted and made very significant steps in teaching the potential trainees to prepare for the bio sketch, because this is where all the information can be noticed in terms of publication, trainings, what's the level of the career for each individual, and so the gauging where they can possibly participate in can be well discerned. One thing that I would like to share, I'm actually directly involved with the collaborative program that's under PAR-22-114, which has a deadline for September 2024, and then another one. It has two receipt dates, one in January. So that's the last round for the cycle, and then we're hoping to have it renewed or repackaged. I would like to emphasize that the collaborative has a 155,000 direct cost and a 255 total cost. And the pool of cancer health disparity experts that you can tap and really look at will be the investigators coming from the PACHI, those who are enjoying the U54, because the name itself, Comprehensive Partnerships to Advance Cancer Health Equity. These PIs have very strong cancer health disparity expertise. So they are the people to look at, and of course there are others, but it would be a very good award set to look at a reporter. And also those who are doing the R21, R03 also, but R01 for cancer health disparities. So the other program that I'm directly involved in is the Early Investigator Advancement Program, and that is meant to help junior investigators, whether they are new investigators or early stage investigators, to be able to write their R01 draft and be successful in that effort. So we provide grant writing workshops, scientific mentors who are seasoned NCI investigators, as well as seminars, mentored mock reviews, to let them have a feel of the essence of how to submit a competitive R01 application. And so far, we have helped a number of investigators from underserved populations get their R01 funding. So we hope to continue this, and this year we have another round, and the deadline will be sometime in October, November, and then we have submitted a reissuance of the concept. And so this is very good for early stage investigators and new investigators to transition into independence, because we noticed that in the training navigation submissions, a lot of the applicants or the potential applicants are faculty. But of course, there are a lot of other opportunities as shown in the slide, and we're very happy to note that. Please check our websites for the latest point of contacts, although we shared that previously. One thing that I would like to suggest, and is a best practice, is really know what the NIH is supporting, and that is through reporter. You can actually use the matchmaker. You can just paste your abstract or what you plan to do, keywords for your interest, and you can look at similar projects that have been awarded, as well as the contact program directors who you can request for a meeting to look for additional information. Because sometimes the first question you need to ask the program director, who is the scientific contact for that funding opportunity announcement, is, number one, is my intention or my training plan or the research plan, is it responsive to the funding opportunity announcement? Because each opportunity announcement has some unique features that will spell out the eligibility. So please take advantage of knowing who the program director is, or for the particular program or for a particular funding announcement, and be sure to determine what are the eligibility requirements that need to be submitted, and that whatever you're planning to do is responsive. The other thing that can be used from the reporter website is that when you click on the reporter, on the upper left-hand side, you will see report and reporter. If you have not done so before, check the report, because it gives you a bucket of all the supported awards that NIH has. You can look at the RCDC, or you can search RCDC under reporter. because that site has actually categorized all the researches supported by NIH into buckets of research condition. And so therefore, I think right now there are about 315 categories. I mean, if you want, I'm willing to work with you. I can show that to you in another webinar, where I can show you a specific sites that you need to look at. The importance of looking at these awarded grants that have been supported by NIH is that you can look at the landscape of the research. Number one, you are looking at what are currently being done, and so you will not be repeating what has been reported before. So you are trying to be unique, and you're trying to be more innovative and very strategic. The second thing that is important in looking at reporter information is that you are looking at the language that's being used, how to construct the abstract, how to construct the aims. So I mean, all of this can be searched. And even if you look at the Office of Extramural Research site, so that's OER, you just search Google OER NIH funding, go to that site. You can even see actual applications that have been approved. So you say sample applications for KFRs. You will find those. So I hope those are helpful information, but if you need us to show you how it's done step by step, we are willing to do this again with you. So please don't hesitate to ask questions. You can send us your queries, and we will respond. And we wish you all the best, and we thank Heidi and the team for this very, very important webinar. And I can feel the heart and your passion in the activities that you're doing. Thank you so much.
Thank you, Anil and Jay. We are so very grateful for the time that you're giving to us. I know how busy you are. In addition, I really want to thank you for continuing to fund that early investigator pathway. I think having direct assistance in preparation for an R01 with someone who has expertise internal to the NCI NIH is really integral. And we will take you up on working with us on perhaps videotaping a short session on navigating the reporter. I think that there might be some lessons to be learned from there. Again, we're just so very grateful for your presence. I think, Heidi, if you can navigate us through some of the questions from the audience, that would be great.
Sure. In the question and answer, you can use the question and answer function, or else you can also just raise your hand to speak, and then we will have you join us. And I think I see one question just came in. I'm just going to note, we did have a question earlier about whether or not one grant can apply to more than one different types of supplements. And the answer was yes. We can certainly cover that, but looks like we have a question from Kyle Hill. How can we get in touch to discuss opportunities that might be a best fit? I'm a junior faculty member affiliated with MCC and SPH. So thank you. Yes, you can connect with me and well, Donna's Choza is away on parental leave right now, so right now it's me. And on the Z link that's on there, it's kind of the everything document. The QR code isn't working, I apologize, but I can send out an email to everyone. But on the Z link there, I have office hours on there, or you can also email me to let me know when if you have some questions. And then Dr. Wally and Rivilleza, how would you like us to connect candidates to the NCI program officers? We have a spreadsheet we report monthly where the officer might reach out to you, or should we reach out to the officers directly?
I think before you do that, it's best to have a bio sketch ready, because Anil and I will determine first before we we share the information with the training navigator. And one thing, because we were asking leadership about these next steps, because one thing that they suggested is that we need to see the bi-sketch and also a kind of mentoring scheme. If you have those information, then please share with us the information and we will make the necessary recommendation. Anil, do you have anything to add?
You covered it pretty well. I think mentor-mentee is most important criteria, because the next step would be we would ask them for a one-pager, as Dr. Rivilleza mentioned about NIH reporter. So both mentor and mentee would be aware as to how to write an abstract, the specific aims. So what program directors at NCI or even at NIH level, they ask for a one-pager. What is the overall plan? What methods you want to use, and what are the specific aims, and what approach do you want to take? So that gives them a lay of the land, overall picture of the project that mentor and mentee are trying to put together, so that program director could take a look at it and tell them, well, this kind of research has been either already funded, or you could tweak it a little bit to make it more innovative, more significant, so they can give you some helpful pointers as to how it could be put together as a competitive application. So that's why we always insist that all these program directors, who are the scientific program directors, contact listed at every notice of award, NOFO, notice of funding opportunity announcement. So it's a very long document, but it gives you all the helpful pointers as to how to put together different sections of the grant, and what are the score driving factors, what is how reviewers will assess your project. And that scientific contact is listed at the end of the notice of funding opportunity announcement. But it's always very critical to go through that, read that funding opportunity announcement as to how we can put together a successful grant application. And then program directors are here to help at every step of the way. Thank you.
Thank you. Was there any additional questions about how to discuss opportunities? Feel free to raise your hand if you'd like to speak.
And of course, oh, I'm sorry.
Go ahead.
Okay. And of course, please visit our website. You know, if you just search CRCHD NCI, then it gives you our website where you can look at the summary of the descriptions of each funding opportunity. And from there you can readily gauge where you are qualified to apply. And then you can, of course, ask questions directed to us if you need additional information. Thank you.
So another thing that, and we have the recording that Drs. Wally and Rivilleza had mentioned, and we can share that out with the people who have logged on to this webinar afterwards as well. I will also put it on the document that is linked with the Z link on these slides. But the other piece of this is that there are some recommended timeframes on when to apply for the various grants that are on the recording, and also we have a PDF of the presentation. So that's linked through that z.umn.edu TN-MCC link. But then also feel free to reach out to me at hje@umn.edu, and I'm happy to email it to you as well. Any other questions or comments or ideas?
I just wanted to emphasize again how Heidi and I really want you to send us emails and ask us questions, and we are so ready to offer our help. If we don't know the answer, which we often don't know the answer, we'll connect you to the right person. There's no wrong question. You are not wasting our time. This is our work. So we're super excited to do this on behalf of the Cancer Center and, of course, the important work of the NCI. So let's continue the conversation. Let's not end it here today, but for the investigators that are here, you might just want to connect your trainees, graduate, postdoc, or even undergraduate students to us, and we can see what we can do to help them to navigate the process. I think everyone has the potential to be an exceptional researcher. We just have to find a way to make sure you get into our programs and find your home here and at the NCI.
Yeah, absolutely. Thank you so much, Rahel and Heidi. And, you know, to all the potential trainees, just like what I tell my children, do not say no to yourself. Go for it. Ask the questions, and we will help you resolve some of the, maybe some confusions or challenges. We will provide you with some guidance. Thank you.
Thank you. We did have one more question about what is covered for the diversity supplement, and it's R01 or R01 equivalents, and it's kind of a lot of the alphabet soup. I did a query. The reason why I know that there's 72 grants that are eligible for the October 1st deadline is there's a query that's linked at that z.umn.edu TN MCC link that I had in the previous slides. And I can also email that out to folks, but it includes a lot of P's, a lot of R's, a lot of U's, and some of the others as well. And it's listed on the document. We're happy to share that with you all. Anything else before we close?
Yeah,
Thank you
if-
everyone for coming.
Okay.
Go ahead.
Thank you. Oh, what I was just trying to say is, if you are thinking of R01 and R01 equivalent awards, these are hypothesis-driven awards. It is very good to have some kind of preliminary data to support that hypothesis. So you can start with that case and the R21s, and those will be very helpful so that you can have the background platform to generate data to support the hypothesis for the RO. Thank you.